Good morning. I am Dr. Sekar, Senior Consultant Vascular and Endovascular Surgeon from Chennai, Kaveri Hospital. You know what is vascular surgery? Vascular surgeons, we deal with blood vessels outside the heart. We are different from cardiac surgeons. We deal with patients developing arterial blocks in the legs, going to the brain, going to the kidney, and all other parts of the body except the heart. So, the arterial blocks develop in patients who are smokers, who are diabetic, hypertensive. These are the three important causes. And of course, age is also an important reason. When the blood vessel gets narrowed, this is due to a deposit of a cholesterol-like material along with calcium in the artery, just like a soot comes in the chimney. So when the artery becomes narrow, the blood supply to the vessel comes down and the part suffers from lack of blood supply. When such a thing happens in the heart, patient develops a heart attack. When it develops in the brain, they develop a stroke. And when it develops in the leg, they develop leg pain, which later develops gangrene, leading to amputation of the leg. So it's very important for everyone to realize such a thing can happen, and we should know the ways and means of preventing it. We must stop smoking, keep walking, and there are many drugs that are taken to prevent these arterial blocks from coming. It is best that anybody who is diabetic, hypertensive, aged, and smokers, whenever they develop minor symptoms like leg pain, they must see a vascular surgeon and make sure that vascularity is adequate. Otherwise, if you catch it in the early stage, it can be prevented by medication, or little later also we can do open bypass surgery, just like what is done in the heart, or nowadays we do an endovascular procedure just like what is done in the heart, angioplasty, where we can pass a wire into the blood vessel through the block and pass a balloon on top of that, stretch that artery, and sometimes if needed put a stent also. There are various advancements have happened in vascular surgery with which we can improve the blood vessel, improve the blood flow, and prevent amputation. That is the whole aim of vascular surgery, and we are specialists in dealing with these kind of patients. So you need to go to a vascular surgeon because we are the most competent people to do vascular medicine, vascular surgery, and endovascular surgery. So we are actually a vascular specialist. The other common disease that you see in vascular surgery is the varicose vein. Varicose vein, as you all know, that it happens after pregnancy, common in women. People who stand for a long time, they develop blood gets to stagnate in the vein, and the vein starts dilating over a period of time, becoming tortuous and enlarged, like a bulbous projection, greenish, bluish veins that are visible. So when you leave them untreated, the blood starts leaking out, the color starts changing, black spots develop, itching starts, and you scratch and an ulcer develops from which bleeding can happen. So these things can be investigated by a Doppler, and then we can decide which of the system, where the valve is at fault, and then we can offer a comprehensive treatment. That is, we can do, earlier days we used to make cuts and remove the vein, what we call as the stripping. Nowadays there are endovascular or endovenous ablation, where we pass a wire and burn the vein either with radiofrequency ablation or with laser, or now with glue, and we block the vein, and the smaller veins are removed or blocked by injecting sclerosant agents. So we can give complete treatment. We can look after the smaller veins, the bigger veins, look after the ulcer. So whenever a varicose vein problem comes, you must go to a vascular surgeon and get it sorted out. Thank you very much.